Hey guys, it's Dr. Braddock, and today I want to show you an exercise. And when we do exercise here in the office, or when I refer to exercise, our chief goal is to make it simple and to make it easy and to make it quick, because unless it's those three things, you're not actually ever going to do it. And we need to do something that you'll follow through. One of the big things that we're constantly talking to people about is the posture. When we look at the x-rays, a lot of times we see that the posture has failed, that it's really starting to collapse forward, and we see people, rather than have a normal posture with the ear above the shoulder, above the hip, we see people's shoulders rounded forward, their back starts to hump, and then their head juts forward. And you can imagine, we're working on computers all day, we're driving, your kids are sitting in school, huge backpacks, and gravity's constantly pushing down on us, and we all have this sort of posture. So when you look at someone, you can see that their chest is caved in and their back is all rounded. One of the big things that we have to do is to start to increase your biomechanical advantage. We have to start to readjust that spine so your spine can literally start to resurrect itself back in the right direction. And one of the big things we have to address, though, are the muscles, because unless we can keep those muscles strong and we can start to retrain the soft tissue to hold the spine in its new normal position, we don't get our results as fast as we'd like, and we don't get them to last as long as we would like. So incorporating this component makes a huge difference. What I'm going to do is show you a simple exercise literally anyone in your family can do, especially teenagers. This is a great exercise, all the way up to the elderly. Virtually anyone can do this exercise. It's really simple. We're just going to use a TheraBand or a stretchy band that you get. I actually got this at Walmart for $6.97. So less than $7, and it's amazing how much you can do with this. And what I'm going to do today is show you something really simple that's going to help the muscles in your back and your shoulders hold your posture in normal position. You can take this and put it on a doorknob, put it through a door, shut the door, anywhere that is at least secure. We obviously don't want that thing popping off and snapping you. Get it in a secure place and take a step back where you start to get a little bit of tension. You want to keep your chest out as much as you can, so we don't want to be like this. We want to push your chest forward and your shoulders back. We want you standing up in perfect posture with your chin looking straight to the sky. And then you want to take and you want to retract these back to where you feel like you're trying to pinch your shoulder blades together. Hold 2 seconds and release slowly. Back, you're just pulling your fist straight to your side, 2 seconds, and release slowly. And you're really trying to force those shoulder blades together. We're strengthening the rhomboid muscles, the posterior chain muscles, so it's going to start to hold your spine here rather than them being weak and allowing your spine to collapse forward. You just want to do about 20 to 40 of those in the morning, 20 or 40 of those in the afternoon. Don't be surprised if you get some soreness back there in those first couple of days, because those are muscles that unfortunately aren't being used and they're worn out. But if you'll start to get in the habit of doing this, and literally you can do that in your closet right before you get in the shower at night or in the morning, and you've got that totally knocked out. If you have any other questions, make sure you give us a shout. And as always, share this video with your friends or family or people who need to know a little bit more about chiropractic. God bless.